My adjournment matter is for the Minister for Health, and the action I'm seeking relates to endometriosis. Endometriosis is an under-recognised disease that affects the well-being of so many. It's an inflammatory condition that most commonly strikes the reproductive organs, but it's also frequently found in the bowel and in the bladder. By the age of 44, 1 in 9 women in Australia have been diagnosed with endometriosis. For many cases, it starts as teenagers, and they experience a range of very painful pelvic symptoms. And for most of them, it takes nearly 10 years for that diagnosis to occur. There are 35,000 endometriosis-related hospitalisations each year in Australia. The Australian government estimates the disease costs close to $10 billion a year. 2/3 of that is in lost productivity. The rest is in healthcare. But our current health system lacks proper care pathways and evidence-based approaches to that delivery of care. A trial underway at Barwon Health is already reducing hospitalisations via an interdisciplinary approach, incorporating cognitive behaviour therapy, pelvic physiotherapy, yoga and education. Last week, I was fortunate enough to visit the Julia Agaru Endometriosis Centre at the Epworth. Now, they're not just delivering holistic, patient-centred care for those with endometriosis, they are dedicated to actually finding a cure. And the week before, I went to the Women's Hospital and met with their researchers and the great work that they're doing in trying to work out ways to minimise the symptoms, but also to treat endometriosis. And I think all of us want to find a way to stop the suffering. But it's time for this good work to stop working in silos. So the action that I seek from the Minister is that they develop and implement a Victorian endometriosis policy and strategy.